go on to the next screen, please. I'm so sorry for these technical glitches that we all face. Never mind, we all are learning new things. These are things to assimilate in our stride with so many other things which we are doing. This is little something about my introduction. I would like to skip this. Just to give it in short, I've been practiced for more than 15 years now. I'm practicing from New Delhi. I passed out from BJ Medical College, Ahmedabad, and now in Delhi from last 15 years. Initially, I did some jobs, but now I have my own practice from last 10 years. Can we move on to the next slide, please? Yes. What do we understand by Medifacial? If we divide the word into two, it's Medi plus facial. Facial means anything which has got to do with surface rejuvenation, something which gives a very good glow to the skin. Medi means under the supervision of a dermatologist. So we are different. First, we have to change our mindset that we are different from a salon facials, which are very different. They are more about just putting scrubs and massages. We are more to do with technical, backup given to us where we understand skin better. We can actually do much better than what a salon. So first we have to remove our mindset that this is not a salon facial. We are using different technologies or one device which give us multiple treatments, and we are able to deliver what our patient oblique client wants. I remember 15 years back, we only used to have a device called microdermabrasion. Many of us are still using it, but then this is a good replacement to a conventional microdermabrasion. And the treatments can be customized as per the skin type that we're dealing with. Is it a young skin? Is it a mature skin? Is it really an aged skin? Is it acne prone skin, sensitive skin? Or in simple language, as we talk to our patients, dry skin, oily skin, normal skin. That's how it is, right? So it can be customized as per the age, the gender, and what skin zones that we look on the face. For us, it increases practice and revenue generation. I mean, we should not shy away from, we are doctors. Sometimes we are very, very hesitant to talk about revenue, money. No, this actually increases the footfall. Our patients are able to, they get confident when they do such treatments, which have no downtime, which give immediate good results. So it has good results, promising results, and value for the money for the patient as well as the clinic. And the best part about these devices are that all probes are either disposable or they can be sterilized. So the risk of spreading any infection really reduces, and it improves the rate of hygiene. So Medifacial, I think, is the new genre, and what I call is like hands-free treatment, where the device will do everything. And with this COVID era, we can actually incorporate in our practice and move on with our other things. Sorry, I'm not able to move the slide. Can anybody help me there?
Doctor, you have the control now.
I have. Thank you so much, Miloni. Right. So today we thought this is our webinar series 1. We'll slowly, gradually take up each and everything that we are dealing with. This is a Synergy equipment, which is Tube Light Synergy Plus. And I've been using it for more than 4 years now. I'm very happy with the results. Yes, you cannot compare it to your fractional CO2 lasers or your fillers or your Botox. I think everything has its own place. We cannot replace something. We actually take it as an add-on. So what I do with this treatment is to make it very clear. We do a deep cleansing with it. We can actually do mild skin tightening, give a brightening effect, and it can reduce the fine lines and help in reduction of wrinkles by doing collagen remodeling. That's how it goes. I'm so sorry, I don't have the control. I'm not able to move on. So sorry for this glitches. Yes. So it's a hand-free device, which is useful in this era, as I said, and there are multiple applicators for a good, management, how you can manage. And 4 novel technologies, which I'll talk in details later, is Aqua technology, Oxygenio, Copolar, and Cosmo. They may sound like very weird, but when you'll understand, you'll be able to know that it's easy and it's a game-changing treatment, right? So this is what Synergy Plus is for. And the best part is you can actually sterilize, disinfect. There are 3 headings which I would love to talk about in post-corona era or during COVID times when we all are starting to open our clinics. One is patient safety tips, that you have to take this treatment as you do your other injectable treatments. Follow the same aseptic precautions. So if this treatment was taking 45 minutes to 1 hour, be mentally prepared, counsel your staff, counsel your patient that it may take at least 15 minutes longer than usual. Generally in Medifacials, we would not like to cleanse the face with alcohol swab. Here, we will actually use alcohol swab to sanitize the skin. And the therapist, the one who's performing the procedure, a mask is compulsory, a face shield to be worn all throughout the procedure, gloves to be worn. Generally, I don't know in your clinics, but I've seen my clinic, the patient will say, can you switch on the AC, switch off the AC? So minimal touching. You have to teach a therapist that once they've gloved, they have to behave that they're doing an aseptic procedure. So they don't have to touch other things here and there. They have to prepare the room very well in advance. And ideally, if we have many people have that bigger team, if it's possible to give them a helping buddy, which can help them with the procedure to carry on smoothly so that this minimal touching is very, very less. And you have to sterilize the equipment as well. The device has to be sterilized. So you have to cleanse the entire machine. You can use your soap and water as a solution. You want to use any hypochlorite solution, you have to cleanse the entire device. You have to mop the entire treatment room with disinfectant based solution. Whatever you feel as a doctor you want to do. Next treatment to be done only after 20 minutes of finishing off the first procedure and disinfection of the entire room. And the best part, there are 4 technologies which are used. 2 tips are disposable, which you can just throw, don't have to use them. And the other 2 can be disinfected easily with an alcohol swab or even put in your spirit solution left for 30-45 minutes and those metal surfaces can be disinfected. So this kind of practice can be incorporated in this corona era and we can go on. It is hands-free because you are not doing a facial with your hands. You're not touching the skin with your hands. You're not doing a massage. It is the device. The first one is the hydrofacial, which is the tip. You're not touching the patient's face. Second is your oxygenation. Again, as I go through the slides, there is a capsugen which comes in contact. You're not touching with your hands, your patient's face. Third is your RF technology. And fourth is your electroporation. So it's all devices which have 2 disposable tips and 2 can be nicely disinfected. So you don't have to touch the face of your patient again and again. Now we would like to do a little Q&A here. Just check in your screens and we would like to know certain answers from you guys. Can we have the question and answer, please? Question. Yes, we do have a short video of the procedure. We'll show it to you. Please answer this question meanwhile. It's a quick poll. It makes it easier to take the ride through so that we know how many of you are using what. And it's easier to have this kind of webinars in future as well. So I would request all the participants to please actively participate in this quick poll so that we know. Thank you so much. So there, we have the results. So out of so many people that we have here, we have 27% saying that they have hydrofacial, 9% saying they have a machine which can do oxygenation, 56% showing that they can do microdermabrasion, 15% have a combination device, another 15% have all of this, which I'm very glad to read at, 11% says none, and 7% say they want to buy. Right? So maximum board which goes to is to microdermabrasion, which is 56%. Here I would like to add, if you just have this machine and you do not have any other device, you can actually do a hands-free Medifacial even with a simple microdermabrasion machine. You can, again, same disinfectant things that you can follow. cleanse the skin, do your microdermabrasion. Instead of putting those, masks which you make yourself, just use a sheet mask. So you can incorporate these things in your practice, which do not take much long, easy to do. So don't think that if you have only microdermabrasion, you can't do a Medifacial. You can name a fancy name to it and get started with this as well, right? So this is very interesting poll where we would know what all people are using, and we can actually customize what we really want to do. We'll take question answers in the end. So whatever questions you have, you can keep putting it so that we know we will answer it in the end of the discussion. Can we move on to the next slide, please? Yes. These are few indications which we have put here. This is what most of our patients want. Many of them come with problem of blackheads. Many of them have whiteheads. They want a deep cleansing and they want removal of all the dead skin cell, which is called exfoliation. Some of them come with uneven skin tone. These are the few queries or concerns that we hear from our patients. So we can actually deliver skin brightening results. Some of them don't want Botox, do not want fillers, are not very open to any injectable treatment, even if it's something simple like PRP. And they've done peels time and again. They don't want to do peels. So you can give such Medifacials or synergy like treatments as an option to correction of fine lines, nourishment, hydration. Then the skin can become more radiant. There's an improved skin texture, enhances the skin tone. And there's something called an immediate feel good factor, which I have seen in most of my patients. They feel very nice after this treatment. So we see instant visible results. Very pleasant. There is no downtime. There is no pain, no burning sensation, and overall a rejuvenating effect. So these are the concerns which most of our patients come in, and I've seen this treatment really fit in very well in a pre-party slot where we say, oh, pre-party facial. Right now we're not socializing. Eventually, let's be positive, we will. So most of the patients, when they have a wedding to attend or they're pre-bridal, the girls who are getting married, such occasions, this treatment really fits in where we don't have to worry about any bruising, redness, rashes, or any swelling coming, which we are worried about with other treatments. So it offers a complete set of solutions for various skin concerns that our patients, oblique clients, walk in. Right. Can we move on to the next slide? Yeah. So if you look at it, this is how the equipment looks like. It's a beautiful looking equipment. And, I like using it. It can be rotated to any room and you can get started. Right. So it's a good treatment to begin with if you want to start with Medifacials, because it incorporates many other things for which we need various devices. Okay, so the first technology which it is using, it has a disposable tip, which is called aqua technology, also known as hydrofacial or a vortex fusion technology. When I use this term with my patients, vortex, some of them get very confused. So to explain the vortex, it's a vacuum technology where the aquatic solutions, the water-like solutions are coming to create a vortex-like effect, which is like a concentric effect, with which we are able to infuse alpha hydroxy acids for deep cleansing, exfoliation, extraction, and infusion. Believe me, this is the most painless extraction of blackheads which I have come across. And as soon as the nose becomes clean, the young girls and boys, they really love it. So this unique spiral design of the vortex, which helps in actually infusing these active AHA solutions and potent antioxidants into the skin. And you can actually customize how you want to do it without giving pain or any downtime to your patient oblique client. Right? So this is called aqua technology. As I'll show you in the video later, it has a disposable tip which can be used. You can look at the picture here. It's beautifully designed. It has how the advanced serum delivery goes, and there is how the patent design is where you can actually infuse these AHAs and antioxidants where the pH is below 5.5. They do not irritate or corrode the skin. The way the serums are designed. We'll talk about serums in details because many of you may ask questions that when we are infusing alpha hydroxy acid, isn't it irritating the skin? It's not like a peel. It's a serum. So it doesn't irritate the skin. And the way the tip is designed, it beautifully gets delivered under the vacuum effect. Next, please. Yeah. So we are able to actually handle hyperpigmentation, oily skin, fine lines and wrinkles. That's how we've divided the serums into 3 zones. They're known as S1, S2 and S3. That's how the product has been designed. And thanks to our people, it's an indigenous product serums that they are giving us. Okay, so we don't have to rely on any import, or sometimes we have problems that we bought the device but the consumable is not available. So it's an indigenous actually designed serums 1, 2, 3, which I'll just go in details with the next slides, please. Yeah, so this is called tube light solution, which is used in this machine, which have a unique composition that helps to cleanse and moisturize the skin much more effective and in a better manner. So we'll call them as Aqua Facial S1, Aqua Solution S2, and Aqua Solution S3. As I said, S1 is pH 3.5, S2 is pH 5.5. The main ingredient in S1 is sodium lactate and citric acid. The another main ingredient in S2 is allantoin, sodium PCA, urea, witch hazel, and MNF. And S3, which is a 6.5 pH, has ingredients which are active like cranberry extract, niacinamide, chamomile extract, and aloe vera. So you can look at it, none of these ingredients are something which can irritate the skin. In fact, they are calming agents, they are moisturizing agents, which will help build the skin barrier function and not erode it. So skin actually looks good after this treatment. Can we move on to the next slide? So we all know, that as doctors, we do prescribe our moisturizers, our other things. So what I would like to talk about is we don't have to go into so much details of each ingredient. If you look at, this is how there are 3 solutions, nicely packed, 100 ml bottle each. If you look at the cost, hardly comes out to 100 rupees per treatment because you have to dilute it and use it. Very easy to use. There is no problem there. So, I'm enjoying using these tube light solutions on my patients. Next slide, please. Yeah. And the next technology which we're using here is oxygemio. So first is clear, which is aqua hydrofacial, where we are actually exfoliating, extracting, and infusing. Second one is oxygemio technology, which uses the power of oxygenation for intense nourishment and skin rejuvenation. You can actually give a very nice peel to your patient that oxygen is vital for life. So here we are using oxygen to actually to actually rejuvenate the skin. And there's a capsule called Capsugen which comes in contact, and there are 2 gels available with which you actually see in the picture, through which you're able to infuse this, and there are these micro CO2 bubbles which are created, which give a Bohr's effect. It's called BOHR, Bohr's effect, through which the skin gets oxygenated and it looks pretty good. So in this peel, when you talk to your clients, so bleed patients, you can say that actually de-stresses the skin, takes care by giving oxygenation to the skin. So people like it. They like to hear such words. So as doctors, do not have inhibitions of not using these words. Next slide, please. So there are 2 active ingredients. There are 2 gel-based things which we are actually infusing. There are 2. Mio Bright is one of them. The main content is kojic acid and azelaic acid. I think all of you would agree with me that these are our favorite molecules, even while writing prescriptions. Kojic acid and azelaic acid, I don't have to go into details. It's also, there is hyaluronic acid added, retinol, and to calm the effect, there is tocopherol acetate and your rose carina fruit oil. So it actually becomes a very nice brightening agent which helps in brightening the skin. Next, please. This is how it looks. It's beautifully packed. And these are the capsugens. When you open it, you actually attach there and you just put this gel and you start doing the procedure. It's hands-free. You don't have to touch things. It's a gloved hand. Don't have to touch things here and there. It's very easy to do. Once you get your hands on, it's very, very easy to do. Next slide, please. The next solution is Mio Revive, which I like to use in mature skin, right? So the first one was for people who feel the skin is tan, there is uneven skin tone. And the next one is Mio Revive active ingredients, where there's retinol, which we all know. We don't have to get in details. It helps with cellular turnover and renewal. There is hyaluronic acid, there is ribose, there is other fruit extracts along with tocopherol acetate and ascorbyl palmitate, which is a stable non-acidic form of vitamin C, a very effective antioxidant which helps in cellular regeneration. Next slide, please. Right, so this is how it looks. The packing is very beautiful. You can, so as I said, with the same device, you can actually customize looking at the skin, how you want to use it. There are 2 solutions given, which you can see, which you want to use. Next slide, please. So what we are achieving is skin plumping and hydrating, a restored skin volume, a renewed youthful glow, increased collagen, and improved skin cell production. So this are very, when I'm telling you, when we use these words to our patients, they really feel nice. They feel this doctor is giving me something which I'm actually looking at. So I feel these words can be used while you're consulting, while you're talking to your patient, that what exactly you're going to achieve with this treatment. Next slide, please. The third one is copolar technology, which uses mild radio frequency for the rejuvenation. It evenly heats the collagen up to 37 to 40 degrees centigrade. And at this temperature, the collagen contracts and reduces the laxity to the skin. So there's no downtime, immediate results. It's perfect for a special occasion. I mean, when I've presented this before, the question which I was asked was, how is it different from the other RF devices that we have? This is not a replacement to our other bipolar, monopolar devices. This is a minimal RF, heat which is coming just to give a superficial dermal edema. As doctors, we can discuss this dermal edema, which gives a little tightening effect to the skin for that special occasion that they want. Doesn't last very long, but it's a very good add-on given in this treatment, where people don't have to think of something else for skin tightening. For people who do not want to do multiple procedures, there are many patients who say that I don't want to do so many things. I just want to keep it very simple, very, very minimal. So it's a very, very good step in cooperative radio frequency, which helps in tightening the skin. Next slide, please. Yeah, and the fourth one is cosmotechnology, which is a special modulated handpiece for penetration of active molecules deep into skin for better effects. Many of us must be using, we can call it needleless mesotherapy or electroporation or ultrasonic. In this particular fourth step, what they're using is a high level sound wave technology, which can actually penetrate the serum that you want to use deep into the skin. Here is again, as a physician, if you say as a doctor, what role do I have? This is where your role plays, where you can customize the solutions, what you do. If you want to minimize, you can actually use their third S3 solution along with the topical tube light C20, which is vitamin C 20% for infusion. You can even use hyaluronic acid. Many of us have these non-linked hyaluronic acid serums available. Even that can be used for infusion. I like to use vitamin C serums for infusion. There are many vitamin C, up to you what strength you want to use. So there are various serums available, and even from the already available ones, you can use either an S3 solution along with any vitamin C to actually infuse and see a needleless mesotherapy effect. It actually improves the skincare penetration much better. So the next is, why do we need this device in our practice? Why do we need it? Can we go back to the previous slide, please? Yes, this is one question after going through how does it help me? Why do I need it? It increases my practice. It increases the footfall. I can actually tell people, my patients, that I'm doing this, which is not invasive, which is very quick, 45 minutes to 1 hour. It increases revenue generation. It is value for money from both the ends. And it's very satisfying for the patient when a treatment is done for an hour. A lot of times, I don't know whether you guys have come across, but many patients come and say, I did a peel, why should I pay? It just got over in 10 minutes. Here, our Indians, they really feel that, if the treatment was just for 15 minutes, why do I have to pay? So they actually take it as a psychological benefit that I know somebody was working on my face for 45 minutes or 1 hour. So they get that satisfaction. You can see immediate visible change. I call it the word as skin goals. They actually achieve the skin goals that they want to achieve. It's a unique technology. It's much more superior than buying different technologies and offering them. And it's elegant design. It's actually a very beautiful looking machine. Looks like an ATM, very cute little long, like, I really like this machine. And it's a beautiful, nice touchscreen display, fully reliable, clinically proven. And there are many of us who are using this machine with great results, and we're very happy. Can we move on to the next slide, please? Thank you so much. This was just one of the marketing videos that we prepared. So you can actually use it to market about your clinic, about this particular device, and it's helpful. So such marketing videos can be created for your social media, for your in-house television, which we all have in the waiting rooms where people are waiting. I don't know post-corona how many would be waiting, but for your social media for sure, that you can use this device and show that how you are making a difference. Medifacial word is not just using a microdermabrasion or a mask. It is actually move on to a better use of better technologies incorporated together in one device. We'll just move on to the video as well. Can we move on to the video of how the procedure is done? Next slide, please. Yes, I'm here to answer all the questions. Let me know. I know there was no sound in that video. I'm so sorry. As I said, this is the first time. We will be better prepared, but this is just to show that how you can use these videos, how this machine is used in your social media, right? Shall I start with the questions that I'm coming up with? Mr. Miswani, are you there?
Yeah, we are here.
So shall I start with question
Yes,
and answer?
yeah, we can start with that.
So first question which I can see on my screen, what's the difference between hydrofacial and synergy? A very good question asked Dr. Chanchal. I have both of them in my clinic. Synergy is actually a combination of 4 technologies that I just mentioned, and hydrofacial is just one technology. So hydrofacial is coming from another company, synergy is coming from another company. I like to use synergy. If you ask me this question, how I decide what I want to do, I like to use synergy for mature skin because it adds much more than exfoliation and extraction. And if I answer this question in a very non-candid manner, if a mother and a daughter are working together, the daughter is 22-year-old, hypothetical, and mother is 50-year-old, I would not like to recommend a same thing. I think most of you would agree. Then they don't like it. So I can actually recommend synergy to the mother and hydrofacial to the daughter. I think, is that clear? Can we move on to the next question? Next question is, how different is this machine from hydrojet where the probe doesn't touch the skin? Hydrojet basically doesn't have all so many steps. It's just for exfoliation. You're actually exfoliating at a great speed with the help of normal saline or any other liquid coming. This one, as I said, is also doing oxygenation, is doing your mild RF, and you can actually electroporate after infusion. So they're like 4 technologies. So it is different from hydrojet in many aspects. See, ultimately we are exfoliating. We are not denying. But it actually calms the skin after exfoliation. That's how the results are fantastic. Another question is no-go zone for the treatment. Yeah, I mean, as a doctor, you have to actually select your candidate. So please do not take up people with very active rosacea, very active acne, pustules on the face. No, that's a complete, you have to deselect such patients. You can't take them up for such treatment. That you have to actually deselect. And as far as you're talking about no-go zone on the face, I mean, if the skin is all fine, it's normal skin, there are really no-go zones area. Under eye, yes, we like sometimes a lot of people, if you just do the face and leave the periauricular area, people don't like it. So we do very mild, the first step, we don't go very close to the eyelid. But yes, this area, I would say the tear trough zone, where as a physician, you can take a call whether you want some steps to be done there or you want to avoid it. Right. Next question is price range of single session and how many sessions required and gap in between. A very good question. See, the consumable cost, Mr. Miswani can throw light on, and up to you whether you want to use the 4th step, which I said as electroporation, where you want to put your other serums or not. You can actually, price it somewhere between 3,500 to 7,000 easily. Up to you where your practice is, what all are you adding on in this treatment. Some people even add an LED, which is like these days becoming very popular. There are separate LED devices available like a mask or a separate LED. So that price you can take from 3,500 to 7,000. The cost of consumables, Mr. Miswani will throw light. How many sessions required and gap in between? I like to keep a gap of good 3 to 4 weeks, just like what I do with other treatments. Like I tell my patient, you to come once a month. They like this because it's for skin maintenance. And sometimes we also combine other treatments along with synergy facials. If somebody is only doing simple synergy facial, I would like to give a gap of 3 to 4 weeks. Any sessions between 4 to 6 sessions are good enough to show the results. Next question is, how will fine lines and wrinkles be treated, as it will increase the expectations of the clients if it is not delivered? A very good question. That's where, when you will actually counsel your patient, is where you have to use this. There should be no unrealistic expectations. Wrinkles cannot be removed. What we are doing is collagen remodeling. So overall look of the face is improving. Fine lines do reduce with multiple sessions. We all know wrinkles cannot be removed, sometimes even with fillers, right? So that is where you don't have to raise their expectation. Your spiel before you start the procedure has to be in such a manner that you're actually able to align their expectations with what you're able to deliver. Hi, Dr. Karishma. How are you? I can see your question. Priming, you know what, in today's world, I've stopped priming my patients even for peels. Most of the people are using AHAs or anti-aging creams and whatnot, and most of them. So if you have to take a detailed history, if you feel somebody is using a very potent active ingredient, please ask them to discontinue at least 2-3 days before, and to be restarted at least 2-3 days after the procedure. But if they're using something which is simpler molecules, you need not prime or discontinue. But if they're on very active ingredients of higher percentage, then yes, you will have to ask your patient to discontinue those things. Okay, how much do you charge for this procedure? I don't know what will I charge now. Earlier we were charging somewhere around 5,500 to 7,000, depending. Like, I don't know how many of you go in packages. I have no answer to this question, that this corona era, what will we charge? Whether should we reduce our prices or should we increase, because our disinfection will take much longer. God only knows. Are we allowed to do Medifacials during the pandemic? How much can we charge for this facial? What's the cost of Synergy Plus machine? See, I think one can do this procedure even during pandemic, as long as you are the person you're treating is safe, you are safe, you're following your safety protocols, you're not doing anything to the skin where there should be a problem. And charges I've just discussed, that you can actually decide what you want to charge, and the cost of Synergy Plus machine would be answered by Mr. Miswani. Mr. Miswani, can you take up these questions about the cost of consumables of the machine later? Everybody is asking the cost of the device. Can we see its live demo after lockdown period? This is again a question to be answered by them. The video was going wrong. I had put a video of the entire procedure happening. But then this question would be answered by them.
About the cost of consumable and equipment, we'll talk in the last. So okay. You can take up all the other questions.
People are asking, can you give a live demo? I would say if we can actually work on that video again and just show them how the procedure is done.
Yeah. We are just working right now to try to play that video later on. So let's take the video, the question answers now.
Right. See, a live demo for even these people would be very difficult to move from one clinic to the another. But videos are there. You have users to talk to. I'll give you my number, Dr. Varsha Pujari. I'll send you my WhatsApp directly of the video, how we do it,
Also, what we'll do is we will email you the link or to the video so you can play at your convenience.
Yes. Then how much should one charge for 1 hour treatment as a beginner? As I said, you can even start with 3,500 rupees, but you discuss the cost of consumable. You can keep your charges very minimal. Depends whether you're charging GST or not. Consumable cost, again, we'll take this up later. How can we use sheet face mask with microdermabrasion? You can. You just have to cut open the pack, take it out with gloved hands and put it. You don't have to make a solution. It's nicely sterile. It's packed. You can actually use it. It's a very good idea. Most of them contain active hyaluronic acid, allantoin, actually a balanced pH, which can be used post microdermabrasion. How long the results last? This is a difficult question to answer. This is what you have to use your prescription to give them a very good regime that they follow. Nobody in cosmetic dermatology, you cannot almost over-promise results. You have to under-promise and then deliver. So the results can last up to 15 days, up to 1 month, depending on the skin that you're taking, what kind of skin is it, what skincare products are they using at home, how are they maintaining the results. So use your pen to actually do this, write good products for them to use it at home, and the results can actually be long-lasting. What is the minimum we can charge the patient per session? As I said, 3,500 rupees I think is pretty decent that you can charge. Video of the procedure, Dr. Aishwarya will soon have it soon, as they're actually working on it. Most of the patients complain about tiny bumps all over the face next day after hydrofacial. What could be the reason? I beg to differ. Not most of the patients. There are very few patients who actually come back about having tiny bumps. Here, probably they are using something like a tretinoin or adapalene or benzoyl peroxide. This is where you have to take a history. Please ask them to discontinue and not to be used. If you think the skin is very sensitive, please ask them to use with a gap of 5 to 7 days. On a regular basis, post hydrofacial, I do not come across tiny bumps. And something called skin purging, whether you guys are aware about this word or not. Many times, when you exfoliate the skin, certain little eruptions which are like acne form eruptions, they become prominent. You have to counsel your patient. That is why examine the patient very well. If you see there is an acne prone skin, you have to take up the patient very, very differently. So just you have to take a history properly before you put anybody on this. Ma'am, can peel done on patients with psoriasis? No. I mean, I don't do any procedures on patients with active psoriasis. And until they're in remission, then you can do it. But with active psoriasis, I would actually say no to any procedures happening. Next is, how do you price Medifacials when compared to peels? I had answered this question while talking. Peels, most of the patients feel you've just done it in 10 minutes. What have you achieved? In Medifacials, they get this satisfaction that yes, somebody was working on my skin for a longer duration. There were multiple steps which were done. So they are able to pay for the Medifacials as compared to peels. As a doctor, you don't have to be dependent on just on Medifacials. You can take your own clinical call and combine. Need not combine in the same day. You can give a gap of 2 weeks and 3 weeks and alternate with peels and Medifacials on certain skin types if you want to do. You can actually explain that this is how I'm going to go about. This is called roadmap. You have to create, see, an aesthetic dermatologist like a huge, you have to create a roadmap. What you think to talk to your patient, what they want, how you can achieve it, what all modalities you can use. I think next discussion will do. Next is, on an average, how much can we charge per session? How often can we do the treatment? I've answered this question. Can give some information regarding steps for glow facial commonly asked in clinic. Yeah, see, glow facial is a term which is coined. You can call anything as glow facial. Simple steps is yes, cleansing. I like to use micellar water many times when people wear a lot of makeup who come with sensitive skin. I also use, if I'm using some active peel, I like to use my pre-peel cleanser, which has active AHA and witch hazelnut, right, extract. So it's up to you how you want to customize. In this corona era, I would actually ask you to refrain from any hand massages. Like in many clinics, when we do a glow facial, we actually include a 10 minutes hand massage. Please avoid that. Okay, that is to be avoided. So try keeping it as hands-free, as minimal, where only the equipment is working and your hands are not coming in touch. Any contraindications? All general contraindications which will be applicable to any other treatment, active acne, herpes, pregnancy, any which you actually use in other medical procedures is applicable to the same. History of sensitive skin, or they have retinoid dermatitis, please don't put them on this procedure at all. Even metal implants, because even if you're using a mild RF here, anybody has a pacemaker or any other metal implant, please avoid using. So basic contraindications remain the same. What will be your plan for disinfection of client walking in, and how to prepare room, as clients will also be very worried? This is like a huge, if I open this up, so many things will have to be discussed here. You have to take a staggered approach. I will call it staggered approach, where you will not let appointments be taken as they were taking before, one at a time, so that there is effective 20 minutes in between preparing the room. You can even make them wear those disposable surgical gowns that are available. You can also wear that, so that everybody, yes, the cost of all this will increase, but there are many things. There are many on WhatsApp, it's circulating how you can plan disinfection of your patient, of yourself, of your clinic, of your devices. So that has to be put in place. Do you do all procedures in one session? I didn't get this question. Yes, synergy, there are 4 steps which we do in one session. If we are combining with other procedures, I don't like to. Some patients I have combined it with photofacial on the same day, but not all. Can we do RF immediately after oxygen or hydrofacial? Please answer yes. The RF which is there in the synergy device, you can actually do it. But if you want to combine other RF devices, if the skin is normal, mature skin, yes, I have combined it in many patients where I have done a hydrofacial and I have done the RF later. I would like to exfoliate first and then do an RF. That can be done, but please select your patient properly and guide them. By and large, on a regular basis, I would not like to combine any of the RF with this device on the same day. How many sessions required a patient with suntan? Oh, suntan depends. If it's like a very mild uneven skin tone, I've seen it even in 4 sessions, people getting results equivalent to what you would deliver with a chemical peel. So it depends what kind of uneven skin tone or suntan that you're looking at. Can we apply it regularly on a patient? Is it safe? It's very, very safe. You can use this treatment without worrying. Can this be performed on a periorbital area? I just answered this question. You take a call as a physician. If you feel that area needs attention, then you can do very mild, very gentle steps in the under eye area. You can use it on periorbital. I have not used it on the upper area, but yes, the tear trough area you can use. I will not call it as a universal law in all the patients, but the ones where I felt I think I can, I have done it. Next question, can we do Q switch and synergy one after on the same patient? Yes, you can. I have combined a few patients where I have done it, but not as a universal. You can. You can. If you wish to, if you think the skin is good enough, it can handle, you can. How long the results last? I've answered this question. Post-care, a very good question, remains the same as a doctor, as a dermatologist. You're supposed to tell them they have to use the sunscreen, which is mandatory because you've exfoliated the skin. They have to moisturize the skin. And you can even put them on some vitamin C serum or a hyaluronic acid serum. Other things like avoid, we tell them not to do any excessive sun exposure for a day or two or heavy exercises for a day, just a day. We've had patients where they did the procedure and immediately hit the gym. Then they sometimes come back with a rash. So certain post-care, which is universal for most of the procedures, that can be given. LED therapy has to be the last step. Yes, I like to use it as the last step when everything else is done. Where I would like to use. In some patients, I've used it before the 4th step. Like after doing 1, 2, 3, which is your Hydra. 2nd is your oxygenation. 3rd is RF. Then I've given LED and then moved on to electroporation, mature skin, where I want the serum to be left on the skin as a leave-on thing and they go home. Then you can't do an LED after putting a serum on the face. Skin has to be clean. So where I felt that I want the patients, the serum should be left behind, where I've taken the LED as my in-between step of 3rd and 4th. How often can the treatment be repeated? I just answered. I like to use it between 3 to 4 weeks. Does this help in under-eye puffiness? Not at all. Not at all. Under-eye puffiness cannot be helped with this stuff. Can dinosaur lips be catered with this machine? Not really. Not really. You can't to some extent, but you have to use your prescription there as a doctor, what you want to do with your patients. It's not a replacement to your fillers. Not at all. Nor is it a replacement to your skin booster injections that you're used to doing. It's not even that. So to some extent you can. Next question, do you give this service in a package? If yes, then how many sessions? Package system we do follow in our clinic, but we give this option to our patients to choose. We don't tell them that you have to take a package. They have to decide. If they're comfortable with a single session, they sign up for a single session. We do offer discounts on a package as all any other cosmetic clinic offers. So ideally we want them to repeat at least 4 sessions. Next question, if we have done one kind of peel, can we proceed with other kind of peel and after how long? Yeah, why not? You can do, sometimes on one face I follow zones and I apply 4 peels. You can do it. There is no problem. There is no rules. You can use your own jurisdiction, whatever peel you want to use with each time, or even on the face, if you want to divide your face into 3 zones, and you can do three different peels in the same sitting also. Sometimes we layer the peels. It's called sandwich technique. Peels is like so many things you can do with it. How many days gap should be there after the peel? Please 15 days gap, because with the peel you've exfoliated. Here also there is exfoliation involved. So let the cellular regeneration happen. So 2 weeks is a good time to keep a gap between the peel and this treatment. If any patients still to do massage, then what can we do? In this time, Corona era, I would say, Dr. Anjali, please avoid massages. If we talk about the normal, where there was no Corona around or which we eventually will reach, then you can actually include some massaging along with your RF. You can, if you want to. Next question, have you ever encountered clients saying that they have more dryness after? Yes, I have encountered. If the usage of beta hydroxy, which is your salicylic acid infusion, has been much more, patient will come back with complaining of more dryness. That's why you're supposed to infuse a hyaluronic acid or a vitamin C serum if you feel the skin is very dry, a mature skin, a very dry skin, lackluster skin. Then you should infuse any of these to actually humidify the skin. How long do the results last after one session? If you give them a good prescription, results last for good 1 month. What should be the charge for peels per session minimum? Peels charging is city to city, peel to peel, up to you. There are doctors charging 500 also. There are doctors charging 3,500 also. That's up to you what you want to use for peels. Can you help with some good serums used for electroporation for dull skin with pigmentation? I like to use vitamin C and hyaluronic acid. It gives good results. There are combination serums also available, where the way peels have come now, there are combination serums also available, which you can use. Just check for active ingredient of a vitamin C and hyaluronic acid. Even lactic acid is one of my favorite molecules, which you can actually infuse for people with dull skin. Post Medifacial treatment regimen, it remains the same. Do give them a good prescription so that they carry on at home to maintain the results. Next question, what is the percentage of glycolic acid used in the serum? This, Mr. Miswani, could you take this up about the technical questions? Mr. Miswani?
Keep it in the last. We will take all of them in the last. Let's finish all your question and answers.
Okay. Can you also help with good under eye peels for dark circles? This is not a. I'm so sorry. This is not a platform where we are discussing peels. If we carry on with these webinars, we'll definitely keep. Mr. Miswani, we can jot this down because the periorbital rejuvenation is itself a huge topic,
Right.
which we can discuss.
Right.
You know, where we use different modalities. And then we can discuss. I'm so sorry, this platform is not right for me to move into what peels to be used for dark circles. I'm so sorry. Next is, can we use mask after procedure? In this treatment, need not use a mask, not required, really. Don't add to your cost of consumable. Even the cheapest of mask will come for $100 or $60 or $80. You don't have to. And already patient is lying down on the cot for good 45 minutes to 1 hour. You add another mask, you ask them to lie down for another 50-20 minutes. I don't see a rationale of using a mask post this procedure at all. Next question, what do you suggest regarding routine skincare and the sequence of the product sunscreen? Okay, this is another huge topic, layering of the skincare products. I mean, this, you know, there are various questions coming. This is called layering of the skincare products. What sequence to give? If I answer it in a nutshell, always give lighter products first and then heavier products later to seal the lighter product. Keep this simple formula in mind while you write a prescription, how you want your patient to use the layering and the sequence. So sunscreen is always the last layer. Can be used for melasma. Don't promise them that it's going to treat the melasma. It will not treat the melasma. It is not a treatment for melasma. But apart from melasma, if they have dry skin, they're looking dull, it can actually do skin rejuvenation. But I'm so sorry, doesn't treat the melasma. Next question, in case of a dry skin, better to electroporate hyaluronic acid first to moisturize and then do right? I mean, dry skin, you must exfoliate. If you will not exfoliate, your electroporation is of no use. So if you, as you look at the steps, they're very scientifically designed. So your last step in a dry skin is to actually do the electroporation.
Okay. Doctor,
people are asking questions on lasers and all as well.
Can we have a poll now and then we?
Yeah, not many questions. I'm so sorry. Let's have a poll.
So we have 2 polls coming in. Request everybody to participate.
Just give me a moment, please.
माइक लगवाना भूल गया आपने देखो टाइम 1 month 3 Dr. Meghna, we already had 250 participants.
My goodness.
It was a very good response, and it is from all over India.
That's nice. It's good to be connected,
Yeah,
in
and
such times. Okay,
best.
I can see the poll results. So we have people who are interested in buying microdermabrasion 7%, 17% want to buy hydrofacial, 31% interest in buying a combination, 57% synergy, and 18% others. Right. Okay.
I'll just explain why we asked you this question, because we have microdermabrasion only, we have hydrofacial only system, or a combination of both, or a synergy. So we have all of them. For others, we don't know exactly what you are looking for, because if you have above 4 systems, then you can do most of the things for Medifacial.
Yes.
So we will stop here and we'll go to a next poll. Thank you very much for this poll. Can we go to next poll?
Hmm.
This poll is started now. We would appreciate your participation.
Yeah, we want you to please let us know what should be the next, so that we keep these webinar series on and we all carry good pearls home, so that we can actually incorporate in our practice whenever time we start. Yeah, so we have the results. 20% want oil control medifacials, 49% want medifacials in acne prone skin, 38% want to know medifacials for sensitive skin, 33% want to know mass based facial results plus economics in clinical, 40% want to know combination of pumpkin peel facial with carbon peel, and 54% wants to know carbon peel and photofacial utility in daily practice. I think majority have voted for the last option.
Right.
Carbon peel and photofacial, the
Right.
utility in daily practice.
Right. So I think we for next webinar we have some nice topics we can take on.
Yes.
And also I think under eye rejuvenation also we can be
Yes, periorbital rejuvenation can be included, because you can actually do a lot of combination of procedures to achieve
That's
results.
correct. Yes. Right. Okay. So we will stop this and okay. So we will go to question and answers.
Yes, sure.
Yeah. All right.
Would you like to ask questions, or shall I keep reading the way I was doing before?
I think keep reading, because otherwise if we start asking questions, then it would be.
But I want you to run that video if we've reached that, because many people want to see how the device is functioning.
Right. That we are trying right now.
You're trying. If we can run that video so that people know how it is done. Right. Okay, there are people who are asking questions on laser as well. I'm so sorry. This is not the right platform for me to answer questions on laser. Could you quickly summarize the steps you do? Yes, the first step is to make it very simple, hydrofacial, which is aquafacial, where you're exfoliating, extracting, two things to keep in mind, which is very, very important. Second step is your oxygenation, where you're using with brightening or an anti-aging solution to actually oxygenate the skin. The third step is very mild multipolar RF, just to improve a little bit laxity of the skin. And the fourth step is ultrasonic electroporation, where you can use a serum to actually go deep down, needleless mesotherapy in a way you can call it. So I have summarized the steps where all aspects are kept in mind to give a rejuvenated skin. It's a multiple platform where four things can be done, one by one. Can only certified dermatologists use this machine, or any doctor can use this? Mr. Meswani, can you answer this question?
This is actually a facial device, so it can be used by anybody. And
yeah, doctors, any doctor can use it,
doctors can use it. And, the best advantage is with for technology, you are able to have multiple combination of treatments which you can offer. With four technology, 4x4, almost 16 combination of treatments are easily able to offer. And we have protocols for each treatment. I can share with you as and when you have the devices.
The next question, LED really working? You know what? LED is, you have to understand, when you do medifacials, you have to come up with lots of things. Everything cannot have that much. Let me be blunt answering this question. Everything can't be like, how much results is it giving? LED is an adjuvant. All alone, as per me, I may be wrong. This is my opinion. Right or wrong is for others to decide. My opinion. LED standalone is not something to really look forward to. Right? Am I right, Mr. Viswani? When you combine it with other things is where you see good results.
Actually, combination treatment works, and I
Yeah.
think now we are in India. We are moving to a combination treatment
Yes.
where a combination works. And again, most important thing is patients are not asking you for a result. The
Hmm.
most important thing, they are asking you for a good treatment which is effective. They are not asking you for a long lasting results.
Hmm. So you have to counsel your patient, and LED standalone won't do anything. You have to use it. It's an adjunct, right?
Yes,
Right. Even
absolutely.
when we write prescriptions as dermatologists, what do antioxidants do? We write it. Let me be like, I'll try correlating. We prescribe it as an adjunct co-prescription, right? It's not my mainstay. Same way, LED is not my main thing. It's just an adjunct, just to add on, to improvise on certain aspects. Next question, can all the four technologies be used in the same session? Why not? That's what it is, how it is designed. You have to use it simultaneously. That's how it takes 45 minutes to 1 hour. So, does it work on dark circle? I've answered this. Scope of this cosmetic treatment COVID era. That's what I meant. That, we all have to start a practice. We all have to, cater to something. We all have to actually offer something to our patients. So in COVID era, if you keep your disinfection, your sterilization techniques in place, you can actually use this device. I don't see a reason why you can't use it. See, for lasers, many people are saying aerosols are generated. Do not use it. Injectables, we are working in close proximity to the face while injecting. Do not do it. With this treatment, you can actually be seated at a gap, and the face is, you can actually do this. I don't think so there's a problem in using this treatment. Next question, with RF, which solution or gel do you use? Once you've done a capsugen, when you see the video, you'll answer. When it's done, you don't need any solution or gels to do RF. RF doesn't need any gels, because that gel which you've already applied works well. You don't need a separate gel to do your RF in this device. Can vitamin C serum applied over face during day? This question, this question I'm not answering. Yes, you can do it. There is no problem, but it is not pertaining to synergy treatment here. There are many questions coming which are about peels, laser. Are the peel off masks worth the hype? How effective are they? I like to use sheet masks in my practice. I don't use any other mask. They are not really something that it's again an adjunct to the treatment.
I'm trying to play the video. Can everybody hear it? Doctor, can you hear it?
Coming and going.
Hi everyone, I'm Dr. Meena, the consultant dermatologist at Delhi Skin Center, Oscars, New Delhi. Today I want to talk about something which is right now very close to everyone's heart. It's the pre-wedding season that everybody is getting geared up to attend various engagements and events because of the wedding season around. There are many treatments which are available, which can be done on the bride as well as the groom and on the relatives, friends, whosoever of the bride and the groom. These treatments have no downtime. There's nothing to worry because people are mostly worried there's a rash coming or some kind of acne eruption. There's nothing like that. It's called four-dimensional synergy facial, where there are four steps to this treatment. First is exfoliation, where we do deep cleansing with aqua and exfoliate the skin. Second step is oxygenation. Oxygen is very vital to the cells. So when we give oxygen under gentle pressure, it just rejuvenates the entire skin. Third step is very mild degree multipolar radio frequency to tighten the skin because of so much of tiredness which comes along with these events. So when you do a little bit of lymphatic drainage with radio frequency, the skin starts to tighten a bit and looks good. And fourth step is infusion of vitamin C serum. Again, a good antioxidant to give an everlasting glow. So this treatment is very popular in our clinic when it comes to the pre-wedding season because people love it and they endorse it. Thank you so much.
So this was just about the video where you can actually make it, to use on your social media platform to come out to your patients and they understand what you really want to see. So that was it. Any other thing? Any questions? Do we have enough time more to take up questions?
Yes, we can take a few questions.
Somebody is saying, can we have the whole presentation again? Miss the beginning, just PPT enough. Can you do that? I think some recording has been done, Mr.
We
Miswani.
have done a recording, so we will share with everybody.
Yeah. Next question is, which is best for removing blackheads? Hydrofacial have a good result. How to follow up? See, hydrofacial, if you're talking about a separate hydrofacial equipment or you're talking about Synergy, Synergy also uses the first step as hydrofacial, which is aqua technology that they call it, which is really good for removing blackheads. I mean, all patients enjoy the way the nose comes out clean. So, next question. Vitamin C at times causes dryness. Any other solutions? You can use your hyaluronic acid. You can use a combination of lactoferrin, lactic acid. There's so many solutions available now. Serums which you can use if you think that vitamin C is causing the dryness. Can we use Q-switch treatment and when? In certain skin, you can do it on the same day if you want to do a laser toning along with Synergy, but better is to give gaps and let the patient come more often, like once in 15 days you can alternate. But if your patient can't come more often, sometimes we're dealing with NRI patients who cannot come more often or who are just here for a particular time in India, you can actually combine, no issues. Can we use it with dental implants? Yes, no issues with dental implants. I haven't seen any problems with dental implants. Yes, Mr. Miswani. Now the question is cost of machine and all that which you have to answer.
There are a few questions in question and answer in chat.
Chat.
Yeah. Have you encountered any erythema post procedure?
In certain patients, yes. I would say a very few percentage where there was, mild erythema post procedure and it settled down. I have not had anybody coming back and saying that I had an irritant dermatitis or contact derma rash, whatever. No. Mild erythema, certain patients with exfoliation can have it, which is normal. Yeah, can it be used for other body parts? Yes, Dr. Karishma, it's a very good question. I mean, we use it on back and arms for a pre-bridal section. They enjoy it. They really love it. So you can use it. Mr. Miswani, I've really used it on the back and arms,
Yeah.
And the girls have been very happy, the pre-bridal. You can use it.
Actually, what you said in your video about pre-bridal, this is some very big opportunity for all clinics today. Offer a pre-bridal packages. And the people, the brides, they want to do something for their full body. This is one of the device which can help.
It does help. I have do it. Legs I haven't done. I've done it on arms and back for sure. Many patients, many young girls, we've done it. And we've had good results because they don't want to do peels. If they go anywhere, what people are really offering is microdermabrasion or peels or a massage. Generally, if you look at any, body treatments, apart from laser hair reduction, most of the people are offering either a body peel. There are some doing a Q-switch laser, which costs a bomb, and takes a lot of time to do a full body Q-switch laser, right? And not everybody is very open to the idea of a laser running all over. So this plays a very good part. Actually revitalizes. I've seen good results in back and arms. They all want to know the cost and all, which you need to. Those questions I skipped. Mr. Miswani will have to answer the cost of the device.
The cost, what we are going to do is we are going to call each of you because we have many options of Synergy as well as a few other machines. So we'll talk to you in person and talk about it.
Yeah. And you can see my number coming on the screen. If anybody has any direct questions, feel free to get in touch with me. I'm available on WhatsApp. I'll answer in the best of my capacity, that whatever I can answer. And if I can't, then I will find an answer and try solving that query right there. Right? So with this, can we wrap up this session?
Right. Anybody has any other questions? Anything? Okay. what would you charge for the treatment for back and arms?
No, what if you look at it, whatever you charge for the face, right, for one session, you have to look at your cost of consumable. If you're using the same amount of consumable as you're using on the face on an entire back, then keep the cost same as the face. But if you feel that the person is taller or bigger back, like we've customized it. If our solutions are going higher than what a single face takes, then we charge double, like two into two faces. That's how we charge. It has to be according to the consumable that you're using.
Right. Any other questions? Can we close the session?
Thank you all. Can I close it now? Thanks a lot for
Meghna. It was very, very interesting, and I hope everybody has learned a lot. And we will keep on doing some webinars which are very educative.
Right. And I would like to thank each one of you for taking out time, listening to me patiently. I am sorry if I, was boring in the middle or went too much into lecture mode. But thank you so much for coming over, taking out time, listening to us. And as I said, I'm repeating myself. If you have any questions related to Synergy, feel free to ask me, and other technical questions and the price and all that can be taken over by our Medical Technologies.
This is
Thank you so much.
One modality which is going to be must in every clinic. Just like you have a microdermabrasion or hair removal laser, this is something which you will need to offer, and this brings in a good revenue. You can keep on coming back every month. They like it. They want to take a package. That's yeah, Dr. Meghna.
Yes. People, they like it. There's a repeat. I've very rarely seen people coming back and saying that I didn't like the treatment. See, those kind of patients you will encounter with any procedure. I mean, all of you ask yourself, there are few handful of patients who always say that they're not happy. So barring those, majority of people, they are happy, they come back, they sign up and they like it. And when you're practicing cosmetic dermatology, you have to have solutions. You can't say I don't have this. You have to have solutions. You have to come up. You have to be very innovative. If you don't have a particular machine, you can have some other device. You have to be innovative in cosmetic dermatology to go on. So this particular device, as I said, I've been using for more than 4 years. I've not had a single complaint. Thank you, Mr. Miswani. I'm very, very happy with the equipment. Really happy.
Okay. Thank you very much, Dr. Meghna. Thanks.
Thank you so much, the CAR team, for having me over.
Thank you. So
take care, everybody. Have a great weekend. Bye. Bye.
Dr. Jyoti, you had some question. We can answer you now.